But it wasn't until my dad was approaching his 65th birthday that he enlightened me to this whole Medicare thing. And, he asked me for some of my help. And I was like, I can do that. Like, I can do all these other complex financial things. Like, I can easily handle this. I was shocked. I thought Medicare was like going to the DMV and getting a driver's license. Like, don't you just like check the box, like, voila, you're on Medicare? Not the case. Again, there are so many insurance plans to pick from. There are so many rules that are out there. And I was absolutely frustrated that for as hard as we all work to save for retirement, we have all these strategies, all these things, no one was talking about Medicare.
Hey y'all, it's Kosta. Today I'm here with my guest, Emily Gang, owner and founder of the Medicare Coach, providing independent, unbiased advice to Americans approaching their Medicare decision. The Medicare Coach is dedicated to helping educate and protect Americans' healthcare rights and retirement savings. Today we're talking about everything you should know about Medicare at 65. So, Emily, for our listeners new to this topic, would you give a brief overview on what Medicare is and why it's so important for seniors to understand as they approach age 65?
Medicare is America's healthcare solution. It was created many years ago when people 65 and over could not get health insurance. And so the idea behind Medicare is that everyone, no matter what their age is, especially over 65, has access to good health insurance. Now, some people like it, some people don't. We'll get into that later on. But most of the time it's 65 and over. There are ways, though, to join Medicare before 65. It's most often through Social Security disability rules or Lou Gehrig's or things like that, end-stage renal disease. But it's mainly for those people 65 and over who are Americans who qualify for those benefits.
And so as you're describing that, I think to myself, well, it's because of pre-existing conditions, or it's because of the liability of aging and all of the expenses that will come for providing medical services. Medicare is meant to cover a lot of those things. Let's just say, for example, and this is just purely for argument's sake, what happens if somebody decides, you know what, I don't know about Medicare, but what about staying on the Affordable Care Act as an option, since they can't necessarily disqualify me for pre-existing condition? Is it a cost thing that gives them, that makes that decision for them?
It's a little more tricky than that. There's a lot of Medicare rules. But what I will say is that once you're 65, if you're on a marketplace plan, an exchange plan, they know that you are eligible for Medicare. And therefore, if you keep one of those exchange plans, they're only going to pay secondary to what Medicare Part A or B covers.
Okay.
What does that mean? Okay. What that means is I got a call from a woman last fall who got a $45,000 medical bill, and she had no idea why, because she has an exchange plan. She's paying over $1,000 a month for it. And she's like, why am I getting this huge bill? There's something about Medicare. Well, her exchange plan refused to pay the 80% that Medicare Part B would have paid. And so that's great if you want to stay on an exchange plans, but one, they don't usually provide great coverage for most people after 65, and two, subsidies usually go away. And so if you're getting a really cheap exchange plan because you have a subsidy, those usually expire at 65, and if they forget to take it to stop the subsidy, they can come back and ask you to repay that. And so it gets tricky. So I always say, do whatever you want, right? People can do whatever they want. But my goal is to help people understand the rules to get good health insurance at the lowest cost. And usually at 65, that's not the solution.
Yeah. You had a unique entry into the world of Medicare. How has your background in financial services influenced the way you approach and advise on Medicare?
Yeah. So to your point, I grew up in a financial planning family, and then I spent my first 7 years at Goldman Sachs managing risk for the bank and our clients and all the things. And I thought I was pretty confident with finances, investing, modeling, risk management, all the things that I feel like is an integral part of retirement planning. But it wasn't until my dad was approaching his 65th birthday that he enlightened me to this whole Medicare thing. And, he asked me for some of my help. And I was like, I can do that. Like, I can do all these other complex financial things. Like, I can easily handle this. I was shocked. I was shocked I thought Medicare was like going to the DMV and getting a driver's license. Like, don't you just like check the box? Like, voila, you're on Medicare. Not the case. Again, there are so many insurance plans to pick from. There are so many rules that are out there. And I was absolutely frustrated that for as hard as we all work to save for retirement, we have all these strategies, all these things, no one was talking about Medicare. And it's a big deal. And I see it too, like the story of the $45,000 woman, right? Like I get stories like that all the time. And I really wanted a difference. So we turned to the Medicare Coach to help my dad and I, because again, I knew I could eventually do it on my own, but I didn't have the time or desire to go through the rules and the companies and the plans, like really understand all the nuances. And so, the Medicare Coach helped us. And then I eventually joined them. Larry, who created the idea, I kind of, took the reins from him. And so I think that bringing that financial analytical aspect to Medicare, our clients really appreciate, because it's not like a free this and free that. It's like, let's talk about it. Let's, and if you want the free stuff, that's great. I'm all about you getting the free stuff on that plan, but let's talk realistically about the good days and the bad days and the pros and the cons, and like, what do you really want out of your Medicare? And so I think we take a much more analytical approach to Medicare, because we are unbiased, because we don't sell any insurance plans. We can really help people understand what's right for them. So I think it's a nice combination of the analytical side with also, I get to help people. I love having my clients love what we do for them. And so it's that fun balance.
If you're approaching the age of 65, you're probably getting an overwhelming amount of Medicare-related mail. How can we distinguish between useful information and junk mail advertisements?
So if you are not drawing Social Security before your 65th birthday, really before at least 4 months before 65, it is all junk mail. It's all junk mail. It's all going to be ads for Medicare plans. The reason I say if you're drawing Social Security before 65 is if you draw Social Security 4 months or more before your 65th birthday, you will be automatically enrolled in Medicare Part A and B. And you will get your card in the mail. Now, people oftentimes throw away that letter because it looks like all the other junk mail, because the junk mail's gotten so good at looking like government mail. So I would say do the test, bend the envelope. And if it doesn't bend, it's trash. If you can bend it and there's a card in there, open it up. Because there's a lot. And the phone call, all the stuff, it's a lot.
How often does it happen? People just throw their Medicare card away.
Yeah, all the time. And we can help them go back and find it. But yeah, it's overwhelming, right?
Yeah. Yeah. So how, just to prepare people for what they're going to experience, does this junk mail, does it start coming at 60, 63, 64? When should people feel like they're going to be inundated with,
plan
mail?
on your 64th birthday. I think it's more or less 64 in 6 months. But again, the phone calls, and even right now, I don't know when this show's going to air, but it's October 12th as we film this. And so we're heading into Medicare's open enrollment period. And so it's October 15th is the start date. And so it's everywhere, right? I'll go to the grocery store, which is 10 blocks away, and I can't get to the I play the game, can I get to the grocery store without hearing a Medicare ad? Not usually. And then I get to the grocery store and there's a gentleman close enough to the pharmacy, but not in the pharmacy to meet the Medicare rules to talk about Medicare plans. So it's everywhere. It's everywhere.
And do you think that some of that has to do with the fact that we're an aging population and that more and more people are disproportionately receiving Medicare benefits versus relative to the rest of the population?
I possibly,
I'm just curious. Okay.
I think it's big money for insurance companies.
Okay. So Medicare Advantage.
Especially Medicare Advantage. It's big money.
Yeah.
And you can see, they publish that in their financial reports. The insurance companies publish their Medicare Advantage profits in their annual reports, and it's big money for them. And so
Maybe we'll talk a little bit more about Medicare Advantage towards the end of the show, because I'd like to hear your perspective, given that you're in the Medicare field. And believe me, we've talked to multiple people about it. We'll get to that at the end.
Okay. I'm not anti-Medicare Advantage for the right person, just to be clear, but we can talk about it more.
Yeah. I'm always curious, people that have a lot of experience with it, their perspective. But for now, let's stick to the consumer-based narrative around Medicare. What does it mean to make the right Medicare decision, and what factors should we consider?
I think what's important about making the right decision is that you know that whatever tomorrow holds, that you can get the best healthcare, the healthcare that you want, without going bankrupt, without having your kids hang out, having to give you money for it, without going through all your retirement savings. It's about having a plan that gives you that confidence that you can get the healthcare that you want and still have a decent life.
Yeah, absolutely. When you say decent life, are those some of the factors? What would you consider for people that have Medicare, some things that they should at least look at in terms of fitting their needs? And let me explain what I mean by that. There are so many Medicare options available to us today. There's Medicare Advantage, there's Part D, there's Medigap. How do we determine which plan is best for us and our individual needs?
Yeah, it's a good question. So we have a process. It's a 5-step process that we've created over the years. And to be clear, the step number 1 is do you even need Medicare? Which I know seems odd, but if we go back to your first question, Medicare rules say by the time you're 65, you either have to be on Medicare or on an employer health insurance plan that meets Medicare rules. So if you have an employer plan that meets Medicare rules and is better cost, better coverage, you should delay Medicare. It has to meet rules though, okay?
Right.
But you start off with that. And then it's what's important to you? Is it your doctors? Is it your medications? Are you traveling? Do you just want the cheapest plan? Do you want that free gym membership? What are your priorities? At the end of the day, what's most important to you for Medicare? And you know what? Someone might say, all I care about is a free gym membership. I am totally fine with a max amount of pocket of $10,000, but I want that free gym membership. Great. We can help you find that. Other clients will say, you know what? If I get cancer, I want to go to Mayo Clinic. I want to go to MD Anderson. I want to go to the best. And I say, great. If that's what you want, this is what I recommend, and this is what you should do. Or the client is like, I already have cancer. I have 18 doctors. I have all these meds. Can you just help me manage the cost around it? Perfect. We can do that too. But it's getting clear about when to join, what are your priorities, and that determines which program you go down, right? Are you Medicare Advantage or are you traditional Medicare? And then from there, it's the details. Again, the doctors, your medications, where you live, what risks do you want to take? All of those things will ultimately impact what fits you best. But it's like finding a skilled nursing facility, right? Everyone's different. Sure. And there's different factors that go into different people. But it's what do you want? And let's figure out because a one size does not fit all.
I mean, but from your perspective, when you're talking to the majority of people, are they more appropriate for just a traditional Medicare? Or do you think that Medicare Advantage offers a component because it's becoming a more and more popular option? I mean, it seems like, from my perspective, it's managed care is essentially taking over. Insurance companies are essentially taking over our Medicaid and Medicare spaces. Is the value proposition essentially, is the fruit actually worth the squeeze?
I always say if you're going to be healthy and you never really need a doctor, any plan works.
Okay.
It doesn't matter. But if you're going to have health issues or at least plan for that day, then probably not. Now, our clients tend to be planners, right? We're a fee-based consultant. Mm-hmm. So I tend to get people who they've planned for retirement. They have a retirement savings. Mm-hmm. They might be healthy or not, but they know that they want to have some opinion about their doctors. And for that reason, most of our clients go down the original Medicare route. because they want that flexibility. Now, again, we're in this period of time though right now where everyone's like, we're changing Part D and Advantage plans. And I get a lot of emails right now that's like, actually, I want an Advantage plan. And I say, okay, let's talk about it. Why? And like, I'm paying a lot for my premiums on original Medicare with a supplement and Part D, and my friends get it for free. Okay. Tell me more. Are you paying a lot for the doctor? Are you paying a lot for your medications? No, we have no cost there. Okay. So we have a couple options. You either pay more for premiums and have lower copays, which is usually the traditional Medicare route with a Medicare supplement, a Medigap plan, or you can go to Medicare Advantage, get that zero premium plan, get that free gym membership. But did your friends tell you what their copays look like? Did your friends tell you everything else? Are your friends have health issues? Now, I had a client with stage 4 cancer, and he was absolutely better off on Medicare Advantage. I have clients who are healthy who are better off on Medicare Advantage. It depends. But most of my clients, once we walk through the process of how Medicare works, they tend to go with original Medicare.
And I think as you describe your perspective and your experience, I think what I can summarize or gauge from, there is, I guess essentially what it boils down to is don't get caught being sold something without being educated. Because I think it's too important of a decision, and it's even more crucial that they speak to somebody that is a professional. And you are obviously a fee-based consultant, and you probably have a better, more operationalized approach to how to be successful after 65 with regards to Medicare than maybe somebody that is not fee-based. But we will talk about that at the very, very end, about what their people's options are in terms of preparing for Medicare. But I think more importantly, the point that we need to make in this is you don't just rush into anything because of that free gym membership. Really talk to somebody that understands the dynamics.
Yeah, I think what's hard too, Kosta, is that people have heard about the marketplace, guaranteed, no pre-existing conditions, and all, kumbaya.
Sure.
Not the case in Medicare. At least not Medicare supplement plans, right?
Yeah.
A lot of people have one chance when you first join Medicare to pick that right Medicare plan. And if you don't choose a Medicare supplement plan when you first join Medicare, in most states, you will never get one.
And you won't have access to it, and so your only alternative is Medicare Advantage?
In most cases, you have a 6-month window when you first join Medicare where you are guaranteed to have a Medicare supplement plan, a Medigap plan, right? And these plans are important because they're really what protects you financially, right? They cover the 20% and some Part B that Medicare doesn't cover. So you have a 6-month window when you first join Medicare. And after that window, in most states, if you want to get into a new plan or even switch plans, you have to undergo medical underwriting. We had a client who was a marathon runner. He was really healthy. He happened to have a kidney stone. He wanted to switch Medicare plans. We said, let's give it a shot. That one kidney stone, uninsurable. I had a client, one antidepressant medicine, done. One blood pressure medication, done. So people join Medicare when they're healthy at 65, and they assume that, this is just a plan for this year. Mm-hmm. But that's not always the case.
Yeah. So the majority need to plan for the long term. So they need to make the right first decision.
Yeah, because I get calls all the time to fix things, and I'm like, I can't fix it.
That's crazy. I mean, we could sit here and talk about all the different details and encounters that you have. We'd be here for 5 hours at least. All right. Medicare can be expensive, whether it's from premiums or out-of-pocket expenses. How should we budget, and are there any strategies to minimize these costs?
It depends.
Okay.
So I work a lot with financial advisors, and they want this number, right? Like, what do we budget for? Medicare Advantage, we tend to budget more money because there tends to be a higher out-of-pocket expense. Not always. But original Medicare with a Medigap and a Part D has higher premiums. So it goes back to like the risk tolerance, the risk appetite that people have of like, where do you want to pay? Mm-hmm. Do you want to pay a higher premium and have lower risk later on, or vice versa? Mm-hmm. So it's really a personal decision. And every client's different. I mean, I have couples who are different. I have couples who usually run different Medicare plans because they're different, and that's okay too.
what is typical premium for Medicare, for traditional Medicare, and then what is the premium for typically for supplement plans, Part D, stuff like that?
So no matter which path you go down, Medicare Part A is usually free because you've prepaid into it. Medicare Part B, at least for 2023, is around $165 a month. Now, if you have a higher income, you're going to pay more for it. So $165 either path you go down. So that's what, almost $2,000 a year for just Part B. Now, Medicare Part D plan, I'd say anywhere from, for 2024, we're seeing $0 premium plans in many areas. So $0 to $150 a month.
Okay.
Medicare supplements, anywhere from $20 to $400 a month. Sometimes higher in certain areas for certain people. So you're looking at I'd say most of our clients are paying between $200 and probably $400 a month on original Medicare. That's a Medigap plan, a Part D plan, plus their prescription copays.
And when you say it's based off of their income, this is the income that they retire with or the income that they've earned? And is it, or when you say income, is it based off their Social Security income, which is essentially based on the income that they earned?
So Medicare looks back 2 years ago to what your income was 2 years ago to determine what you pay for Medicare now. So for 2023, they would look at your 2021 income and say, you made over $180,000, you're paying more for Medicare. Now, there's ways to appeal that if certain situations exist. We help our clients with that. But they look at your income 2 years ago. And so if you retired and your income was higher and now it's lower, you're probably getting a high income penalty. So again, there's ways to work around it, but it's not your current income.
You see, this is exactly why people should talk to a professional, because this is the first time I heard that. So think about it like this. If I was somebody that was going to retire at 65, I would immediately expect to report a much lower income at 63 so that I wouldn't be hit at, at a higher income when I actually have Medicare. But nobody's talking about that. And you see, and that is, in my opinion, and I'm about to get on a soapbox here, so just pull me off whenever. That is the fundamental problem, is that the messaging is only about, the messaging is only about funneling people into a different plan. It's not about helping people prepare and educating people. And that's just shame. That's a real shame. So, yeah. Can I ask you, though, the cost of a Medicare Advantage plan? Like, I know you said it varies, but typically what do you see in terms of premiums for Medicare Advantage?
I had a client yesterday who wanted to switch, and his plan would have been $0.
Okay. But what would the implications of that be?
That plan had a $6,000 out-of-pocket cost. So if he might not hit it every year, and that's fine. But if we're going to budget for it, I'd say let's budget for you hitting the full amount. Right. There's other plans that have $1,000 deductible, right? If you're in their network and you're okay with a network doctor, you can get a fairly cheap Advantage plan with a range of out-of-pockets on those plans.
Mm-hmm. And let me ask you about the network. So is pretty much every single doctor in the traditional Medicare network?
Studies show about 95% of doctors accept traditional Medicare, original Medicare. Yeah.
And people are very familiar with the current insurance model prior to Medicare. And so Medicare Advantage, it's very fragmented. And so, if you are with Blue Cross and Blue Shield through your employer, you may only have access to a certain network of doctors. And I'm assuming Medicare Advantage works the same way. So if you have, say, for example, Cigna for your Medicare Advantage plan, you're going to be confined to a lower percentage of doctors that accept Cigna for their practice. Is that correct?
Correct.
Got it. Medicare isn't static, and changes can occur annually. How do we stay informed about these changes, and how might they impact coverage?
Yeah, so we're in that period right now where the plans change every year. So during Medicare's annual enrollment period, October 15th through December 7th, everyone can change their Part D and Medicare Advantage plan. So once you're on Medicare, we can't change everything, but we can make changes around those types of plans. So, right now I'm really focused on the Part D plans. I mean, we are just starting our reviews. I think we've done about 300 reviews so far, and about 66% of our clients are recommended to either switch plans or switch pharmacies, and that average savings is around $1,300 for the upcoming year. And so, especially if you're on a fixed income, and that can go a long ways. I mean, so the challenge is that people will be like, my plan's great. I'm happy with it. Like, I don't want to deal with changing plans. Well, that's great that you don't want to change plans, but your plan is changing. So the premiums are changing, the copays are changing, the preferred pharmacies, the doctors are changing, the out-of-pockets are changing. All these things are changing. So whether you like it or not, like, the cheese has moved. And the question is, like, do you want to go to the new cheese, or do you just want to stay where you're at? And it's But everyone should, if you were on Medicare, everyone should be reviewing their Medicare Part D and their Medicare Advantage plan during this period to save money. Because
who do they talk to? If say, for example, they can obviously talk to you.
Yeah.
And so how do they talk to you? But let's just say they can't afford a consultation. Where else can they go?
So you can go to Medicare.gov. Medicare.gov has a database that can at least help you get started. Now, we find that if you don't know what you're looking at Medicare.gov, though, you can overlook things. And so it's a good tool to get started on. And if you're simple, it can work. There are free SHIP resources across the country that are usually, you can usually get in contact with through the Social Security office. And they have volunteers who can also walk you through the basics. Again, if it's simple, they could probably help you. I would rather them go there than other sources. But I'd say either Medicare.gov, but be careful, take it with a grain of salt in some ways, or the SHIP offices do have volunteers who can help. And if you feel you don't get the help that you need, raise your hand, ask to be transferred to someone more senior who might be not a volunteer and really know the ins and outs of Medicare. There's some fantastic people and resources at those local SHIP offices. Mm-hmm.
Can I ask, just to give people a clear expectation, is it super expensive to talk to a consultant on Medicare? And obviously it's very beneficial if you have complex medical needs, but I'm just curious.
Yeah. So for us, and we're the leading consultant in the country when it comes to consumer-based advice, our concierge service is around $2,000 to get people onto Medicare, and there's other things involved. Right now we're taking new people who are new to Medicare, but if you're already on Medicare, you're not currently a client, we're not taking any new clients. And so we can't help people if you're already on Medicare. It's just
it's super complex.
It's too complex, and it's usually in a lot of ways too late to make the switches that we want, and we're at capacity. I mean, we're busy. But I'd say there's other ways to do it. And I'm working on an information-based product to help people do more of this, to even help them navigate through Medicare.gov. But we're just not quite there yet. So
yeah. All right. Last question, then we're going to wrap. If you had a magic wand, you could change one thing about not just Medicare, but the overall process of the beginning stages of accessing Medicare to, while you have Medicare, kind of the whole cake. If you had a magic wand and you could change one thing, what would it be?
The thing is, Medicare works really well when you know how it works.
Yeah.
So Medicare isn't necessarily broken right now. There's a lot of news about it being broken and horrible. Medicare is actually a really good health insurance for most people if you know what you're doing. And so maybe it's that education piece that, I wish the government could afford more help, afford more quality, not just volunteers, right? But afford real Medicare experts to really help people get the help that they want. And that doesn't exist. So maybe that would be my request, is just more independent people who are very knowledgeable. They know the rules to look at. They know all the things. Because Medicare is not broken right now if you know what you're looking for. Medicare can be absolutely fantastic.
And there was a significant program during the rollout of the ACA where people were essentially incentivized to be those coaches and I know that obviously that has mixed results, but ultimately there was something that was created for people prior to Medicaid. Prior to Medicare. That's a huge population subset that are accessing these resources to educate themselves about the ACA. The more people that I talk to, I think that two things would help on the education piece, because I agree with you. I think that that's something that needs to happen more than anything else. The system itself, like you said, works great. There needs to be some kind of subsidy so that smart individuals and capable people like yourself can build organizations to be able to give people the tools without them necessarily having to pay for it out of pocket. That's going to be a huge thing. The second thing is I think there needs to be some kind of push for financial planners to create partnerships and maybe even divisions for that matter, to be able to incorporate this into the long-term plan, into the retirement planning process. Right now, when I talk to people, and I'm gonna go on a small tangent. When I talk to financial planners, the majority of them are deathly afraid of talking about retirement in terms of like being sick or physical ailments, or just the idea that you might, not live to 100. And they want to keep it like really cheery and rosy and things like that. And so they shy away from all of the very complicated things like long-term care insurance, Medicare planning, so they don't even spend the time educating themselves about it. So I think, shifting that to your point is going to make a big change.
Yeah. And unfortunately, a lot of those financial advisors, not all of them, some of them are fantastic and they understand the impact, but a lot of them have been paired up through their brokers even to refer out to insurance agents. And so those advisors are getting kickbacks from you getting sold a Medicare plan that doesn't actually fit you either. Because they don't understand the implications. And that makes me sick. Yeah,
absolutely. Well, I know which way you lean on the Medicare side. So
again, Advantage can be good for the right person. If there's education around it, I have zero issue with it. It's the lack of education. It's more of the sales pitch and lack of education that frustrates me, because that's great. You just made a commission, but this person has this horrible plan for the rest of their life and they weren't fully educated on it. And that's like, they've worked hard for these Medicare benefits. Like, they should have access to the best stuff for them, whatever that looks like, but at least be educated.
Mm-hmm. We always like to end the show with a call to action. For our listeners about to turn 65 and feeling overwhelmed by Medicare, what would be your best piece of advice to help them navigate this crucial time with confidence?
Say, go to my free online workshop. You can go to the Medicare-Coach.com. There's a free workshop button there. Join it. It's a 90-minute session where I will walk you step by step through the process I recommend that everyone takes to make Medicare. If you join that workshop, you will avoid the massive mistakes. So go there. It will make your life easier. And it's really the shortcut to Medicare.